I first came to Olympia Orthopaedic Associates in 1994 and have been in practice here 24 years. Initially, the first visit with me involves both taking x-rays of the involved hip or knee, an examination which usually shows the loss of motion of either the hip or knee joint, and then also questions about how this is impacting your lifestyle. For outpatient surgery, the patients are seen preoperatively by a physical therapist for prehab to sort of educate them on what will be expected following surgery. During the hospital stay, the patient comes in typically about an hour before surgery and receives an IV and meets with the nurse and gets gowned up, and then surgery takes place. My average time for hip or knee replacement is approximately 35 minutes. After surgery, patients are generally gotten up walking full weight bearing within an hour of surgery. And we find that at the outpatient surgery center, patients within 3 to 4 hours of surgery are typically headed out the door and ready for home. For both total hips and knees, I prescribe physical therapy. Generally, patients are going 3 days a week for a 4 to 6 week period. Although I invite patients that once they've achieved a certain level where they feel competent and feel they could carry out these activities on their own through their home gym or a local gym. Some of the most common questions asked of me by patients that are candidates for a total hip or a total knee are, number one, what won't I be able to do after surgery? And the answer is, you'll be able to do absolutely everything. You're encouraged not to run on pavement for exercise, although I tell my patients they can run to catch a cab or run from a dog. I have patients that have summited Mount Rainier, patients that have ridden the Seattle to Portland bike race in a single day. I have patients that have returned to snowboarding and skiing. The second question that I'm often asked is, am I too young or am I too old for surgery? And the day that we find that we cannot enjoy this life we've been given to the extent that we care to enjoy it because of our particular ailment in the hip or knee, that's time to have it fixed. The elderly patient for total knee arthroplasty was a lady who was 103 years old. She lived independently after surgery for 6 additional years at her own house, passing away at 109. And lived an active life, and was healthy enough for the surgery, had a nice recovery. Often the feedback we hear from patients is how they found Olympia Orthopaedics helpful at every step of the process, that the connectivity with the group, with the practice, with all the team members was exceptional. My patients have told me that my enthusiasm for their recovery was what propelled them on and made them feel safe, made them feel comfortable, made them have hope for their life down the road.